So today we're going to talk about a topic that came up as a request a couple months ago when we were looking for everybody to give us feedback on what topics they'd like us to cover, which we are always continuing to look for additional topics and add those to the list. But one of the topics on that list was neurodiversity. So I thought I'd just give a bit of an overview of what that term is and means. It was good for me to look up because it's a term that I've heard a whole bunch without ever having looked up officially what it means and where the term came from. It is an umbrella term that was coined by Judy Singer in the 1990s to promote equality and inclusion of what she called neurological minorities. So really it was an advocacy effort to encourage non-judgmental language. Largely, it could be said that it describes what we might refer to as more high-functioning clients, less so maybe some of those that are on the lower functioning end group that need a lot more supports. But that's kind of a generalization, and I certainly wouldn't want to make that a blanket statement. Per AANE, so that's the Association for Autism and Neurodiversity, the term neurodiversity is used to communicate the brains are different and that no one type of brain is better than another. In fact, this type of diversity enriches the community. From Merriam-Webster, the formal definition is just that individual difference in brain functioning are regarded as normal human variations within the human population. It's the concept that differences in brain functioning with human populations are normal and that a brain functioning that is not neurotypical should not be stigmatized. And really about that inclusion in a group or organization or group of people, maybe with different types of brain functioning or different types of cognitive styles. So given the extent of overlap between conditions, and the underdiagnosis of females who often present with anxiety and depression or eating disorders, the estimated prevalence across all of potential neurodiversity conditions is estimated to be around 15 to 20% of the population. So it's a huge number of individuals. And you could see this overlapping skills and strengths chart, which I thought was a really neat way of looking at all of the things that maybe fall underneath the term of neurodiversity. So things like dyspraxia, dyslexia, ADHD, Tourette's, autism spectrum, various mental health conditions. And really, depending on what you read, it's going to be more limiting or more broad for all of the potential things that it's covering over. So digging into the academic literature, too much of what I read felt like it was about a controversy or potential controversial nature of the term. Thankfully, I stumbled across Dwyer's 2022 article that examined the potential sources of a potential or theoretical controversy, and really broke down the concept as an interactionist approach. So that interactionist approach being that middle ground between the medical model and a social model of disability. Where the neurodiversity approach strongly suggests that diversity of minds and brains should be valued. Under the medical model, often neurodivergent individuals are described using stigmatized terms, things like things being described as deficits or disorders or restricted, where one of the insights from a neurodiversity approach is to use a more subjective, that's a really subjective value-laden terminology, where the flip side of that, the social model, which in some cases can be taken to extremes, claims that pathology within the individual is not really the thing, that it's more that the society's response to individual impairments is the cause of the problem. But neither the social model nor the medical model could really account for all of the things. For example, someone who struggles with an executive function still might encounter time management challenges even after they start using maybe a scheduling app or have accommodations. So it really is this balanced approach. So this is just kind of a graph of how to look at the medical model versus strong social model versus neurodiversity approach. And under the neurodiversity approach, the idea is that challenges arise from both a combination of actual impairment due to whatever the disorder or diagnosis is, and or the environment. That not all, we don't need to target all behaviors with or potential symptoms with interventions, and not all environments need to be revamped. that really we need to look at this from a holistic approach. So in the interactionist neurodiversity framework, an intervention could operate at the individual level, so maybe a stimulant medication for a person with ADHD symptoms, or by changing the environment, by maybe removing environmental distractions, or doing things that both change the environment and the individual. And that the decision between the alternatives shouldn't be based on really our perception of the cause of it, but what is going to enhance the quality of life for the individual that we're working with. And the individuals themselves are likely to have crucial insights about what would be most helpful for them. So through a neurodiversity approach, it allows for interventions to be targeted to attempt to promote well-being and teach adaptive skills, while not necessarily endorsing interventions that could be stigmatizing and make the person feel like they're trying, like we're attempting to normalize them. Neurodiversity is a strengths-based orientation, and the intention is to destigmatize. So neurodivergent individuals have many strengths, and we should be looking at those and how to promote their success and thriving. Things that, we could focus on challenges, we could focus on strengths, and I tried to create a little bit of a fun graphic so that you could see that there's two sides of this, where you might have poor time management. You could also might be super creative, where social communication might be sometimes a challenge. You might be really good at storytelling or attention to detail. Traits are not in any particular order. They are not all-encompassing, just trying to create some kind of a visual representation. And really in medicine and healthcare as a whole, but as humans, we do have this natural desire and kind of an urge to put people into tiny little boxes, put everybody in a nice little category, but neurodiversity is really asking us to resist that urge. Remembering that deviation from the norm is not inherently pathological. Is a behavior or a symptom dangerous? Is it distressful? Is it dysfunctional to their ability to function within their family, society, a particular situation? Or is it just different? Because those are all really important to look at. And from a therapy lens, we need to distinguish between personality traits, behaviors, that could be described as part of kind of core to the person as what those things are that are maybe distressful and need to be worked on in therapy. As always, talking with our clients about what it is that they want to address is going to be the most helpful approach. But beyond our clinical work, we really need to think about neurodiversity in terms of the workplace, because we're seeing many more interventions and much more focus on creating safe, positive workspaces for people with neurodiversities. And, I'll kind of couch it as a joke, but we've all had that one coworker who's a little bit off. And to be fair, I'm probably that coworker in many situations, especially to those of you that know me well. A day of a sensory overload. It's not a pretty sight. But truly, we'd have to consider neurodiversity outside of all of the clinical context and really thinking about, our day-to-day lives. So there's actually a lot of workforce-based literature and kind of from the business side of things that is looking at this. And so a former CEO of Cisco, John Chambers, was actually quoted saying 25% of CEOs are dyslexic, but many don't want to talk about it. And noting that if leaders identified as neurodivergent, maybe the rest of the workforce would feel more comfortable. Other reasons to focus on neurodiversity in the workforce is that it helps us to broaden our traditional focus of diversity, equity, inclusion. There's actually higher rates of unemployment amongst individuals who are neurodivergent than the rest of the population. Frankly, it's the law because of the Americans with Disabilities Act. It's also going to help reduce stigma. And as the previous slide noted, different can mean very unique, enhanced, specialized skills or perspectives that are being brought to the table that maybe other folks don't have. I've said for a long time, a little bit of OCD can be a really helpful trait in a lot of scenarios. It was certainly very helpful when I was in grad school. And there are some days that I feel like I could use that a little bit more when I'm trying to organize things. So how to look at and consider accommodating neurodiversity within our workspaces? So allowing for adjustments to a workspace station to accommodate sensory needs. So small adjustments, whether that's sound sensitivity, offering a quiet space for a break, communicate if loud noises are going to be expected, if fire drills are going to be, if we know that there's going to be fire drills, offering noise canceling headphones, tactile things, allowing modifications if there's a particular thinking about scrubs, if you have to wear a particular or any type of uniform or standardized clothing, are there modifications that allow for a tactile issue? And movements, so things like allowing the use of fidget toys or extra movement breaks, offering flexible seating, being very clear in your communication and your work expectations. So on the communication end, maybe, and probably more broadly, we should avoid sarcasm unless we know the person really well. Also potentially avoiding euphemisms and implied messages, be concise in both our written and verbal communication, breaking tasks down into small steps and clear instructions, informing people about workplace or social etiquette. Don't assume that people know what the etiquette is going to be. Workplaces can be very different, and I see this across the board. I mean, one mental health agency is one mental health agency, one high school is one high school. So going from one to the next, we can't assume that people know the social etiquette of that particular culture. So don't make assumptions. Give people a planned notice or advanced notice if you know that something is going to change. Not everybody adapts to change super well. Some places don't change very often, and so that's going to be easy. Some places change very rapidly. Letting people know at the front end what to expect with change can always be helpful. And be patient, kind. And because this is who I am as a person, and I think humor helps most things, which I will not insinuate is in any way representative of my workplace or my colleagues or anybody else, but to me, humor is the way to go with most stuff. One of the articles, it was actually the Dwyer article, noted this really fun website that was written by an individual who has a diagnosis of an autism spectrum disorder. And it's a satirical website, which he calls the Institute for the Study of the Neurologically Typical, where he describes the neurotypic disorder in our traditional DSM kind of pathological language, highlighting deficits of typically developing people, such as extreme or abnormal seeking of comfort at times of distress, constant or excessive social play, blatant overuse of modes of communication, marked oblivion to the changes and aspects of the environment, abnormalities in production of speech, including volume, pitch, stress, rate, rhythm, examples being gregarious, grandiose tone, overly emotional or syrupy melody, over-controlled pitch, markedly abnormal nonverbal communication like direct eye-to-eye contact, facial expression, body posture, or gestures, constantly looks at the other person or smiles when making a social approach. So, I don't know, a little bit of fun there for your day. But most importantly, when thinking about neurodiversity, language matters, just like with every other thing that we run into with our clients and patients. Think about how they choose to self-identify. Use their choice of language, respect their choice of language. Do what seems the least stigmatizing when you're speaking off the cuff, but whatever their choice of language is and however they identify is what we should be going with, and embrace our differences, accommodate what we can, and reduce stigma. So here's some formal citations and a variety of the other websites that I referenced. And I will stop my share.